Good morning, ladies and gentlemen. It's a great pleasure to be here. And today I will give you some rules to bring the medical field and the technologists together. In 2006, we introduced the very first engineer in our department, which is the Department of Oromaxillofacial Surgery. And we did this because we wanted some help in planning, evaluating, discussing our head and neck operations in a three-dimensional way. Now, a few years later, we have 15 engineers working in almost every surgical department of the university hospital, also working in 3 other universities in the Netherlands. And on some occasions, friends, colleagues, they ask me, how did you do this? What is the key for this success? Because we want, as we heard before from the minister, we would like to copy your concept. And so I started thinking over the reasons and the mechanisms in the background, because in the beginning we thought, yeah, there are no reasons, there are no really rules in the background, it just happened. But just by thinking over what happened in the first years, I finally end up with some 10 rules, and I would like to present these rules here today. So one of the first and most important things is that we do not want to change anything. I'm a little bit fed up that we are telling each other for years now that we have to change the healthcare system tremendously, because otherwise terrible things are going to happen, like bankruptcy and total breakdown. We prefer to respect the past, and we add new things, or as we call it in the 3D world, we augment the reality of our department with another dimension. In this case, a third dimension. So we keep the old things, the good things, and we add. And if you do so, you will see that you have a tremendous increase. If you do the right things, you also end up with a kind of an exponential curve. And I think that the long-term results that you can achieve in this way are offering you a wider scope than these quick win changes. So we just add and add and add and augment. Another very important thing for integrating new things in your department is that you have to create a very safe structure. For instance, in our department, we have 3 vertical lines, which is we do dental surgery, we do facial surgery, we do oncology. And in the 3D lab, the guys, they are working with soft tissue imaging, they are working with bony imaging, and they are working with dental imaging. And we combine these 2 structures, and we end up with 9 cross points. And these 9 cross points, that's where the PhD students are. On every cross point, we have PhD students. On every cross point, we have specialists. On every cross point, we have co-workers. And even when we are selecting new co-workers, we're just looking, do they fit in one of the cross points? And doing so, we end up with innovations in all the cross points, and we can implement these innovations then in the daily work. So very important, especially when you have young co-workers, give them a safe structure. And within these safe walls, these supporting walls, we give them all the freedom ever possible. But with freedom comes responsibility. And when you achieve this, when it's possible to give them as much freedom as possible, they will feel that freedom and responsibility are 2 congenial virtues, a little bit both the same. Look at this. This is the most beautiful example of freedom. This is Leonard Bernstein conducting his 3D lab. He's there, massive, in the front. He's doing nothing. But they feel that he's there. And he's just showing appreciation and giving a safe environment. He's even not using his baton, not at all. He's just staying there. And he tell them the story, their story. It's not his story. It's the story of all his co-workers, of all his engineers. I think this is a fantastic TED Talk by Itai Talgam. You should look at that next weekend. 4th point, your co-workers, in my department, we have a clinical department, we have a surgical department, and these engineers, they want to work in this department. So that means that they are interested in patients. They want to be part of the healthcare system. If they were really interested in molecules or nanoparticles, which is also great stuff, I know, they would work in a science lab. But they are working in a clinical department. So feed them with clinical information and explain them the clinical problems and summarize the clinical problems in projects and in work packages and translate this to them. So try to speak their language and try to teach them your language. In this way, make it as clinical relevant as possible. It has to matter. It's not about the exceptions. We did the same. We made the same mistakes ourselves. When you have all this nice technology, you start with the most difficult cases. Don't do that. Start with the easy cases, the very easy cases, and do a few hundreds of them. And if that works out fine, then you can go and you can level up and you can do the difficult cases. And after a few years of experimental work, the German calls it the Sturm und Drang, after a few years, you have to agree with each other in which direction you're going. And therefore, you need a kind of a mission statement. It doesn't have to be a real mission statement, but it works. And tell this mission statement to each other. Everybody who works in this department has to agree with this mission statement. If you do not agree with the mission statement of your organization, you should leave. You cannot work and function in an organization if you do not love the mission statement. So if a new coworker comes in, he has to agree. Otherwise, he's going to have a sad professional career. And make it visible. Make it visible. In our department, the mission statement is like this in the social room. Everybody has to see it every day and to agree. Now, number 6. A very important one, of course, because it's the title of the presentation. How do we create professional interaction? Now, I think time is over that medical departments should be dominated by doctors. Because a lot of other professionals are as much important as doctors, as surgeons, internals, and so on. So what we do is we finish the story of the doctor's room. Now the doctors, and we finished also the story of the 3D room. The doctors and the engineers are sitting together in one room. So the engineer that is in charge for the oncological planning is sitting in the room of the oncologist. The one who is doing the craniofacial planning is sitting together in one room with the doctors who are doing this craniofacial work. And in this way, they have to drink coffee together, they have to discuss all day together, and that's where it happens. It happens in the social rooms. It never happens in the research meetings. In the research meeting, you can discuss things, but the real brilliant ideas, the great moments, they pass on the floor, in the coffee room, and so on. So what we did in our department is we invested a lot of money in a very beautiful social room. Very important, much more important than another computer or other toys for the boys. Next thing. In a lot of medical departments, you have young doctors. Most of the time, those are the residents. And always when we have a new tool, a new innovation, a new process, we always ask our residents to start immediately with this new thing. Because for them, it's not new. It is the first thing that they have ever seen in planning or in working out. So by doing so, after 2-3 years, a new tool is completely normal in your department. Most departments do this wrong. They give a new tool or a very nice thing to the most experienced surgeon or the most brilliant and older senior staff members. And then they look at it and say, okay, it's nice, but in the last years I did this way, so sometimes I'm going to use this one, sometimes I'm going to use this one. But if you give it to the youngsters, it's new for them and they will implement it very, very quick. And after 3-4 years, your staff members, they have nobody to talk with anymore. Because for the youngs, the system is completely changed. And by doing so, we did do this in our department, and I can tell you, it's not that easy. This is our staff, and we have now really the residents in the center of the organization. The innovation, the implementation of the innovations goes very fast, very quick. And if you are on this level, that your technicians are really part of the department, then you have to put them in responsible positions. Our engineers, some of our engineers are really in the staff. They're really staff members, and we make it visible. We put them on the front page of the Radbode, which is the magazine of our university, because we want to make them visible. And it's important for the young engineers that they see, okay, this department is investing in technicians, not only in doctors, and they have something like a leader, and this leader is in the staff. So we bring these people in leading positions. Now, 2 to go. An important thing is that, in fact, money is never an issue. And it's a little bit strange. I come from Belgium and I worked a very long time in Germany, but now working for 12 years in the Netherlands, it's really easy to get money in the Netherlands. It's if you compare it to other countries. So I'm fed up with everybody who's trying to tell me that there is no money for innovation, that there is no money for nothing. It's not true. And it's very important, being a leader of a group or being a leading engineer in such a group, that you give the impression to your young co-workers that money is not an issue. And you will take care for the money. okay? And as I said already, there is a lot of money. You just have to work hard to get it, but it's there. Finally, and that has also to do with money, your human resources are always in the lead. What we see around in other departments, other universities, is that people, they have some money, and then the first thing they do is they buy a Da Vinci or stereophotogrammetry, cone beam CT, whatever. And then after 2 months of initial enthusiasm, they call me and they say, Stefaan, it doesn't work. It's rubbish, the service is bad, the company is not taking care for us, so we're not going to use it anymore. There are a lot of stereophotogrammetries around in this country, and they're not used. The reason is that they are thinking that they can do the job by themselves. So doctors are always thinking that they can do anything. They can work with the computers, they can work with the stereophotogrammetry, they can work with any difficult machine. They can't. So even if you have only a few €1,000, you have to invest this in a fellow or in a student, and then ask the student or the fellow to organize new money. Because if the student or the fellow has to organize the new machine, he will take care that this is the best machine for this job, for this place, for this department, because he has to work with this machine. So give the responsibility to the youngsters, to the technicians, and give them just a little bit money and tell them, okay, now you are going to organize some more money, and some more money, and some more money. So the human resources are always in the lead. So with that, I think there are many other rules, principles that can create interaction and success when you're implementing innovations, but nevertheless, I think probably this one or two or three of these 10 principles can help some of you by organizing or reorganizing your department. And with that, good luck.